Hi guys, this is Jason Williams, DO. This is the Williams Family Medicine channel. This channel is intended to help patients live their best life. Today I wanted to talk about autism. Autism is a developmental disorder that affects communication and social interaction and often is associated with repetitive thoughts or behaviors. There is a spectrum of disease, as in how patients are affected, but it can be severely disabling for both patients and the caregivers. The Centers for Disease Control indicates that 1 in 44 children will have autism as of 2021. I checked back into some of the older autism diagnosis type studies from the 60s and 70s, both in Europe and the United States. And depending on which study you looked at, it indicates that between 2 and 4 per 10,000 people were diagnosed with autism at that time. One might argue that recognition of the disorder is the reason for this increased diagnosis. However, there are many other thoughts relating to the incidence, such as exposure to toxins, environment, etc. One of the interesting links I found was that women that had polycystic ovarian syndrome had a much higher incidence of having a child that had autism. The cause of autism is actually unknown and may be multifactorial. There's speculation that children that have autism have mitochondrial dysfunction, theories that glutamate, which is an excitatory neurotransmitter, is excessive in these patients and causes cell death. Hormonal changes such as estrogen and testosterone have also been implicated. In 2021, 1 in 27 boys was diagnosed with autism, and 1 in 116 girls diagnosed with autism. Because of this, many people speculate that estrogen may have a protective effect. To come back to the polycystic ovarian syndrome scenario, women that have polycystic ovarian syndrome seem to have a 35% increased risk for delivering a child that ends up having autism. Women that have polycystic ovarian syndrome have an androgen excess, meaning an imbalance between testosterone and estrogen, where the testosterone component is higher in relation to the estrogen. The polycystic ovarian syndrome link is very interesting because this condition itself has become more prevalent in the past 20 and 30 years. In some cases, polycystic ovarian syndrome can be linked to hyperinsulinemia and dietary intake of carbohydrates. There is a large anti-vaccination movement that claims that vaccines can cause autism. I don't see any clear evidence of this, and I do have papers that indicate the safety of these vaccines. This video is not a debate about vaccines and autism, though. Just my observation from what I found from reading the literature. If a patient has autism, there are some treatments that make sense that could help with the symptoms and quality of life. I think it's important to stress that if we can prevent autism, that would be great as well. If there is a true link with dietary intake and we can modify this, that would be great to prevent autism. Some of the treatments that make sense for autism after it has been diagnosed include diet interventions. One of those includes omega-3 fatty acids. A couple of these are DHA and EPA. It is thought that omega-3 fatty acids help with cell signaling and nerve health by improving membrane stability. Omega-3 fatty acids probably also have an anti-inflammatory effect. Common sources of omega-3 fatty acids include sardines, anchovies, mackerel, eggs, walnuts, chia seeds. Another obvious intervention is a low-carb, high-fat diet. Low-carb, high-fat diet can result in production of ketones. Ketones have been shown to have interesting effects on nerve and brain tissue. Ketones have been studied and have been shown to be the preferred source for mitochondrial energy for the brain, even more efficient than glucose. Ketones increase GABA tone. When we think about neurotransmitters, we have GABA and glutamate. GABA tends to be the relaxation, resting type of stimulation. Glutamate tends to be the excitatory type of stimulation to the nerves. With ketones, we are enhancing the GABA nerve transmission, having a calming effect. Glutamate, on the other hand, has been shown to damage nerve cells and even kill them at times. Some of the other health conditions that are thought to be secondary to excess glutamate exposure include ALS, MS, Alzheimer's disease, Huntington's disease, fibromyalgia, and even chronic fatigue syndrome. Besides autism, glutamate exposure seems to be linked to schizophrenia, anxiety, and even obsessive compulsive disorder. Ketones also increase the release of brain-derived neurotrophic factor. This promotes survival of nerve cells. Gut microbiome health has to be an important consideration for someone that has autism. Experts say that there are more neurotransmitters in the gut than there are in the brain. The conversion of the amino acid tryptophan to serotonin actually occurs in the intestines. Of course, serotonin is one of the neurotransmitters that is involved in mental health disorders. Gut microbiome health can be improved by using dietary sources of prebiotic fibers, such as artichokes, garlic, leeks, and onions that can feed the probiotics. Probiotic foods include fermented foods, sauerkraut, kimchi, and yogurt. Probiotic supplements exist and often are also needed. Some experts believe that vitamin deficiencies can also be responsible for autism type changes. These vitamins include zinc, iron, magnesium, and iodine. I don't know how prevalent these deficiencies are in the case of autism for most. I did investigate folic acid because we commonly recommend pregnant or women that are going to become pregnant to take folic acid to prevent neural tube defects. I ran across conflicting results with folic acid levels and incidence of autism. I did find one study that said excessive doses of folic acid results in a double increased risk of autism. In a similar light, I looked into vitamin B12 and noticed that excessive B12 levels results in a 3 times increased risk of autism. Autism is a complicated problem and needs to be diagnosed properly. Screening can be done by your family doctor. If your child has autism, then you may have to have specialized treatment with a mental health provider. I hope you find this information interesting. I would recommend at least attempting lifestyle intervention to see if it can help. There's an amazing story of a child with seizures who went on a ketogenic diet and completely reversed his seizures. This is a child who had even had brain surgery and multiple anti-seizure medications without relief, having multiple seizures a day. The story is very interesting and publicized because his father is J.J. Abrams, a famous film producer. He actually discovered in a medical library ketogenic diet and recommended it to his doctors. Once that diet was implemented, his son Charlie stopped having seizures and dramatically improved and now is very functional. Any type of treatments like this may seem far-fetched, but worth a try, very little to risk. I don't want to in any way downplay the severity of autism and the effects it has on patients and their families. I just want to give them hope that there are other things, other alternatives that you can look into. If I'm your doctor, you can use this as supplemental information. If I'm not your doctor, you need to see your own doctor to discuss your medical health and conditions. This is Jason Williams, DO, helping you to live your best life. This is the Williams Family Medicine Channel. Have a nice day. Thanks.